Hi, I'm Dan Lagani with Silver Solutions, the home-related services company for families with aging parents. On this episode of Agewise, we tackle one of the weightiest subjects that family caregivers with an older parent have to take on, and that's the subject of dementia. Our guest today is Dr. Miguel Rivera. He's an adult psychiatrist in private practice who specializes in working with patients in the latter stages of dementia. There's so much to cover, we'll jump right into it. Dr. Rivera, thanks so much for joining us today on Agewise.
Thank you for having me, Dan. Pleasure to be here.
So, Dr. Rivera, I want to start out in the most fundamental way. What is dementia? How many forms of it are there? And where does Alzheimer's fit in?
The definition that makes the most sense to me is one that the Harvard Department of Neurology was using, in which they define dementia as an acquired and substantial change or decline in three main areas. The first one is cognition. So this involves things like memory, use of language, executive function, ability to reason, visual spatial awareness, your capacity to know where you are in time and space. Like, for example, how do you navigate in your car to get home? So that's visual spatial awareness. The other area is activities of daily living. So declines in your ability for self-care, for hygiene, to be able to dress yourself properly, those kind of things. And then last but not least is changes or decline in behavior or comportment, so that people with dementia can many times get agitated, they can have personality changes.
One of the things that I think everybody who's a viewer of Agewise and the topic of dementia that they'd want to understand is, what are the early warning signs? And how do I distinguish between my mom or dad just having a bad memory and really seeing some form of cognitive impairment? What do you look for?
If you go to the Alzheimer's Association website, you will see the 10 warning signs of dementia. And these are things like short-term memory loss, forgetting things, forgetting appointments, repeating themselves over and over again. There can be issues with the use of language, for example. People with dementia can begin to have word-finding difficulties or begin to have problems in their understanding of written or verbal language. Problems with executive function, so things like balancing your checkbook, be able to plan and sequence things, can be affected. People can begin to misplace things. And for example, it's not so much of not knowing where you put your keys, but actually maybe finding your keys in the freezer. So like really putting them in places that are very unusual. People can present with personality problems. People can be very affable and friendly and all of a sudden turn into somebody kind of irritable and cantankerous.
I do want to understand a little more what % of the population is affected by some form of memory disorder or cognitive impairment. What are the statistics? Because I've heard things that say as much as by the time you're 85, almost a third of the population has the beginning of Alzheimer's. Is that true? Are we talking about something with a magnitude that is that large?
To answer your question about the statistics, so just talking about Alzheimer's, which, as I mentioned, is the most common type of dementia in people 65 and over, about 13% of those 65 have dementia of Alzheimer's type, but that number doubles every 5 years. So by the time that people get to be, like you said, in the middle 80s, then it's actually, close to 40%, between 38 and 42, 43%. So yeah, it's huge. And then when you consider that is just Alzheimer's disease, like that doesn't include vascular dementia, Lewy body dementia, frontotemporal dementia, Parkinson's dementia. That number, which is almost 50-50, is only Alzheimer's disease.
Well, it really is a staggering figure, especially when you put it into this context that the 85 plus population is the fastest growing segment of the population in America. So we are dealing with something obviously that is only going to get larger. And with that in mind, are there things that we can be doing? I'm 57. Are there things that I should be doing that give me a better chance of not developing some form of dementia as I get older?
The main, let's say, the breeding ground for these diseases is inflammation. So what are the things that we can do to decrease the inflammatory drive in our body? Because inflammation leads to cardiovascular disease in the heart, and also leads to strokes in the brain. Inflammation leads to, it's one of the processes that, that leads to the complications of diabetes. And inflammation is also one of the main risk factors for the development of different neurodegenerative disorders like Alzheimer's. If you address inflammation, you address everything. What is good for the heart is good for the brain.
If I'm looking at an older parent and I start to see behavioral changes that I suspect may be the beginning of dementia or Alzheimer's or some other cognitive disease, what should I do next? What's the appropriate course of action to follow so that we can do all of the things necessary?
Don't put it off. Get evaluated. Go to see a neurologist that specializes in dementia or a psychiatrist that specializes in dementia. During my residency program, one of my professors, Dr. Bueno, always used to say, when it comes to cognitive problems, time is of the essence. The longer you wait before having that person evaluated, the less the chances are that you may be able to do something about it.
Let's move on to your practice specifically. How did you become focused on dementia patients, and particularly, if I understand correctly, you're working really with moderate to severe cases of dementia. So how did that become your area of specialty?
By no decision of my own, Dan. It was, when I finished my residency, I actually, went into private practice and with my partner at the time, that was a family medicine doctor. And we created a alternative medicine practice where we had a yoga studio and we had a full-size kitchen. And we thought, we're going to teach people to exercise. We're going to teach people to eat. We're going to change the world of medicine. and it actually, we knew how to be doctors, but not how to be business people. So that venture did not go very well. And as that was kind of dwindling and disappearing, I actually got a call from Dr. Bruce Robinson, who was the director of geriatrics at Sarasota Memorial Hospital. But before taking that job, he was the director of geriatrics at Tampa General Hospital, where I did my residency. And I got a call from him one day saying, "Hey, Miguel, I heard that you are in town, and I was wondering if you could do some consults for me." And interestingly, Dan, if there was one area of psychiatry that I felt really, really comfortable in, was in doing consults. Because during my senior year, the fourth year in my psychiatry residency program, we had some extra residents, so we did not do standard rotations. So I ended up actually doing 8 months of consult liaison psychiatry at the James A. Haley VA Hospital in Tampa. And they had 3 floors of nursing homes there, of nursing home patients. And we were the service that was covering them. So I had the opportunity not to be part of that service, but to actually lead that service for, as a resident for 8 months. So when Dr. Robinson said, "Can you do some consults for me?" I was like, "Oh yeah, I'm happy to do that." And most of the residents who are in a nursing home who have dementia, are already in the moderate to severe stages of the disease.
When you're working with patients that have advanced stages of the disease, what does success look like? If you're doing your area practice well, and I'm sure you are, what's the change that you're hoping to enable?
So no matter how far they are along the disease, and even though, dementia by definition is relentlessly progressive, it continues to get worse over time, but there are things that we can do to help their quality of life. So there are things that we can do, for example, to minimize their behaviors. We can do things to improve their sleep. We can do things to keep them from hallucinating. We can help them with paranoia. We can help with depression and anxiety symptoms. So unfortunately, this disease that we call dementia comes accompanied by a whole host of nefarious, partners there. And even though we at this stage of the game cannot do much to affect the rate of decline or the process itself of dementia, we can definitely do things to improve their quality of life by addressing these associated symptoms.
Now, we've talked a lot about the dementia patients. What about family caregivers? Do you work with the family members much? And at what point does that intersect with the work you're doing with the patients?
A lot, Dan. As I can tell you from my own experience with my dad, dementia is a family disease. It affects every single member of the family. So a lot of what I do is to counsel the family members, to encourage them to take care of themselves, to encourage them to seek out help, to address if they're depressed or anxious, to address those issues, because the reality is that if a caregiver is either depressed or distressed about their life as they care for their loved one, they have a 67% higher mortality rate than those who are of the same age who are not in that situation, of having to deal with somebody with dementia.
You've mentioned a couple of times, and I would be remiss if I didn't ask you to explain a little more. Your dad, you said, suffered from Lewy body. What type of dementia is that, and how was your professional training able to help on a personal level?
So it helped a lot, Dan. And but even though I possess this knowledge, it was a really tough road to traverse. I know that it affected my mom. I mean, it took her years to recover from this experience. And as it presented with my dad, like I mentioned earlier, he presented with Parkinsonism. So he began to have problems with balance and coordination, and that led to falls. And it led to a big lifestyle change for him because he was an athlete. He loved to play tennis. He was a golfer, and he loved being outside. And within a matter of a couple of years, he was wheelchair bound. And by the end of the disease, he was actually bedbound, and so severely that he couldn't even hold himself up sitting down. So there had to be somebody there all the time. I remember him one day just beginning to cry. And I said, what's wrong, Dad? And as I was holding his hand, he said, Miguel, this is my life.
Let's end on a high note. We've covered so many areas, and candidly, we could go on for hours more. But what's one thing that you're optimistic about in terms of the care and treatment of various forms of dementia that you've seen emerge recently? What's the optimistic note that we may be able to end this subject on?
That dementia can be prevented, and that luckily, what the data is truly showing is that we can prevent this. It's just like cardiovascular disease, Dean Ornish in the 1980s was the pioneer on this idea that cardiovascular disease is preventable and reversible. He was the first one that, because then Dr. Esselstyn and so many others have written similar books about being able to reverse cardiovascular disease. But in general, the items are pretty much the same, which is be mindful of your diet, make sure you get physical activity, manage the stress in your life, manage the depression, live a life of purpose, try to help others, volunteer, learn a new language, keep yourself learning.
Dr. Rivera, how can people get in touch with you if they want to reach out directly?
My wife and I have a YouTube channel called Dr. G and G. I also have a website, drmiguelrivera.com. My office number is 941-921-9576. And those are probably the easiest ways to get a hold of me.
A fascinating conversation. Dr. Miguel Rivera, thanks so much for joining us today on Agewise and for making us all a little smarter about something that's so crucial to the aging process, understanding the range of things that are called dementia. I'm Dan Lagani. If you like this episode of Agewise, please refer a friend onto it. And if you want to see other episodes, just go to our website, silversolutions.com. Click on the video tab and you'll see all of our episodes. On behalf of all of us that work so hard every day at Silver Solutions to keep you and your aging parents safe, thanks so much for joining us. Stay safe and be wise.